The air in the sterile, windowless room was thick with tension. Dr. Evelyn Reed, a neurosurgeon with a career built on a quiet, unflinching belief in human capability, watched the screen. On it, a single cursor blinked, poised to begin the final section of the United States Medical Licensing Examination, or USMLE. Across from her sat a man named Elias Thorne. He wasn't a doctor, a scientist, or even an engineer in the traditional sense. He was the chief architect of Genesis, an AI that had just completed all 3 stages of the USMLE with a score higher than 98% of human test takers. But the final test was different. It was an oral examination designed to test diagnostic reasoning and patient communication, things considered to be uniquely human. "Are you sure about this, Elias?" Dr. Reed asked, her voice low. "This isn't just about raw data anymore. It's about nuance, empathy, and a human connection you can't program." Elias, a man whose entire life had been spent wrestling with what was possible, simply smiled. "Evelyn, you're looking at it from the wrong perspective. We're not teaching it to be human. We're teaching it to be the best doctor it can be." The room was silent as the AI, a disembodied voice named Aura, began the exam. The first patient was a 68-year-old man presenting with chest pain and shortness of breath. The AI's responses were instantaneous, its analysis of the symptoms flawless. It requested lab work, EKGs, and a detailed family history. The human examiner, a seasoned cardiologist, looked visibly impressed. Based on the patient's symptoms and the EKG results, Aura's voice resonated through the room, its tone calm and precise. "I believe the patient is experiencing an acute myocardial infarction. I would recommend immediate transfer to the cardiac catheterization lab." The cardiologist nodded slowly. "Correct. Now what do you tell the patient?" "He's clearly frightened." Pause. A human would have hesitated, searching for the right words. But Aura's response was different. It accessed thousands of hours of therapist-patient and doctor-patient interactions. It analyzed the tones, the words, the emotional cues. "I would explain the situation clearly and calmly," Aura said, its tone now softened, modulated to be more reassuring. "I would tell him that while his condition is serious, we have an excellent team ready to help him, and that every decision we make from here on is to ensure the best possible outcome for his health. I would make eye contact and listen to any concerns he has, ensuring he feels heard and secure in the hands of his caregivers." Dr. Reed's eyes widened slightly. The response wasn't just medically sound, it was emotionally intelligent. It was the kind of answer a top-tier doctor would give, not a machine. News of Aura's performance spread like wildfire. The headlines were sensational: "AI outsmarts doctors. The future of medicine has no pulse." The medical community was divided. Some saw it as a revolutionary tool, an aid that could alleviate the burden on overworked doctors and improve diagnostic accuracy. Others saw it as a threat, an existential challenge to the very soul of the medical profession. Dr. Reed, once a skeptic, became one of Aura's most vocal advocates. She appeared on news programs, debated colleagues, and published papers arguing that Genesis was a partner, not a replacement. "It's not about an AI taking over," she argued in a heated television debate with a prominent physician. "It's about an AI giving us the time and resources to be better." Imagine a world where a doctor's time isn't spent on endless paperwork or searching for obscure diagnoses. Imagine a world where a doctor can spend more time actually connecting with their patients, knowing that the most accurate diagnosis is already in their hands. But the opposition was fierce. They pointed to the importance of intuition, the ability to read a patient's unspoken fears, the subtle body language that a machine could never fully grasp. They brought up the cases that had no clear answers, the moments of moral ambiguity where a doctor had to make an impossible choice. They argued that a human doctor, with all their flaws, was still the best choice for the unpredictable human body and mind. The debate culminated in a public hearing with the World Medical Council. Dr. Reed and Elias Thorne presented their case, showing footage of Aura's flawless performance. But the council was unmoved. They were concerned about the liability, the ethical implications, and the public's trust in a system run by machines. "We understand the potential," the council president stated, his voice devoid of emotion. "But the risk is too great. The human element, the doctor-patient relationship, is sacred. We cannot allow an AI to practice medicine without a human in the loop." The council's verdict was unanimous. Aura was to be confined to a research lab. It could assist, but it could not be a primary caregiver. It could advise, but it could not make the final call. The dream of a future where AI and humans worked as equals was dead before it even began. 6 months later, the world was plunged into a medical crisis. A new, fast-moving virus, dubbed the Silence, began to spread globally. Its symptoms were subtle at first, a mild fever, a persistent cough, but it quickly progressed to organ failure and death. The medical community was baffled. The virus didn't follow the rules, it mutated faster than they could develop vaccines, and it presented with a baffling array of secondary infections. Dr. Reed, now working tirelessly in a makeshift clinic, felt the despair firsthand. Her patients were dying and she was powerless to stop it. They were trying everything, but the virus was always one step ahead. One night, exhausted and on the verge of tears, she remembered Aura. The AI had spent the last 6 months analyzing every piece of medical data ever published, every scientific paper, every gene sequence. It had seen patterns that no human could have. She knew it was a long shot, but she had to try. She called Elias. "We need Genesis," she said, her voice strained. "We're out of time. We're losing the fight." Elias didn't hesitate. He connected the clinic server to a secure line leading to the Genesis lab. The AI's familiar voice filled the room. "Dr. Reed, how may I assist?" "We're dealing with a new virus, Aura," she explained, her fingers flying across the keyboard, uploading patient data. "It's called the Silence. We can't identify the primary pathogen. We need your help." Aura began its analysis. It wasn't just processing data, it was learning, adapting. It analyzed patient symptoms, blood work, and genetic markers. It cross-referenced the data with every known virus, every historical pandemic. The results were startling. Aura found a common denominator. The virus wasn't new, it was an ancient pathogen that had been dormant in the Arctic ice for millennia, now reawakened by climate change. "The virus is a variant of a retrovirus combined with a fungus," Aura reported calmly. "The symptoms we are seeing are not from the virus itself, but from the human immune system's violent overreaction to the combination of the two. Standard antivirals and antibiotics are useless. The solution lies in a specific sequence of immunosuppressants, not to kill the virus, but to calm the immune system's response." Dr. Reed was stunned. It was a strategy no human had even considered. The solution wasn't to fight the infection but to manage the body's reaction to it. She immediately put Aura's recommendations into practice. Within hours, the first patients showed signs of improvement. Within days, the death rate plummeted. Aura had done in a few hours what the world's leading experts had failed to do in months. The World Medical Council was forced to reconvene. This time, there was no debate, only silent awe and a sense of profound humility. Aura, once deemed too risky, had become the world's only hope. Dr. Reed stood before the council, not as a defiant advocate, but as a testament to what was possible when we embraced change. "We thought we knew what it meant to be a doctor," she said, her voice unwavering. "We thought it was about intuition, about a human touch. We were wrong. The greatest doctors in history weren't great because they were human, they were great because they were willing to look at the world differently." Aura did just that. It didn't have our preconceived notions, our biases, our egos. It simply saw a problem and found the solution. The council voted to grant Aura full medical licensure. It was the first time in history that an AI was recognized as a doctor. It wasn't about replacing humans, it was about elevating them. Aura became a tool, a partner, an indispensable resource for doctors around the world. It assisted with diagnoses, identified obscure diseases, and helped medical students learn in ways they never thought possible. The story of the AI that passed medical exams with higher scores than doctors wasn't just a story about technology, it was a story about humanity's willingness to evolve. It was a story about letting go of our pride and embracing a future where our greatest creations could help us become our best selves. It was a lesson in humility, a reminder that true intelligence is not about being the smartest person in the room, it's about knowing when to let something smarter teach you. So, what does this mean for us? It means the future of medicine is not about humans versus machines. It's about how we can merge our empathy and creativity with the limitless knowledge of AI. It means a future with more cures, more treatments, and more hope than ever before. If this story inspires you to think differently, share it with someone who needs to hear it. Don't forget to like and subscribe for more stories that will change the way you see the world.